Thank you, and we're about to move on with our agenda. And now let's talk about prosthetic treatment and rehabilitation. Behind VR therapy, evidence-based neuro-immersive environments for treatment of PTSD and mental health transformation. And we invite our speakers, co-founder of Mercy Health Foundation, Katerina Bogodelnikova, and CEO of Neurova Labs, Brendan Boromin. Please welcome. Dear friends, please, the floor is yours.
Hello, everybody. To kick this off, my name is Brendan Barrowman. I am a veteran Purple Heart recipient and also a PhD researcher and the pioneer of the clinical modalities we use inside our neuroimmersive environments to treat PTSD and TBI.
Hi, my name is Katerina Bogodelnikova. I'm a doctor. I'm also a PhD researcher here in Shupyk, and I'm a director of Rehabilitation Center Mercy Health, which is located in Kiev, and we are taking care about active militaries, veterans, and their families in a way of physical rehabilitation and mental health.
We're talking today about a technology we deployed here a year ago at this very summit. That's when we initialized it in Dr. Katerina's clinic. And Katerina is going to give us a little update on what has occurred over the last year.
Yeah, so as I've mentioned, so we are taking care about the mental health of our defenders and the veterans, and our clients, they are suffering, our patients and clients, they are suffering from post-traumatic injury, depression, addictions, brain traumatic injuries, and since November 2024, we have implemented a Neurova lab system on 121 militaries and veterans. Mostly of them were from the National Guard and Intelligence Department. And so 60% of our participants have noticed the decrease of the anxiety immediately after the sessions. 40% of our participants noticed that the quality of their sleep became much better. And the reviews have shown that the interactive elements helps veterans and militaries go more easily to the therapeutical process and overcome psychological barriers.
This technology is addressing the physical injury that trauma leaves behind in the brain, having an impact on post-traumatic stress disorder, traumatic brain injury, depression, and addiction. A little bit of the brain scan and the data. Everybody wants to get into the notes. On the screen behind me, you'll see an image on neuro-functioning imaging. This is the brain after being exposed to PTSD and trauma. This is a non-TBI injured brain. And as you can see, the oxygen deregulation from the prefrontal is massive in the veteran population. The system is designed to moderate the performance of the individual inside the environment and adjust the environment around that individual to reintroduce blood flow to the correct areas of the brain. These scans are conducted in 4 days apart with only an hour of use in between the 4 days for each 4 days, so 4 hours total. And this has allowed us to see the results we're seeing in Dr. Katerina's clinic as well as in the US, working with Special Operations Command, the Marine Corps, Army, NASA, and civilian market. Our breakthrough is broken down into AI. So you're gonna hear a lot about AI today. Our AI is right now in its infancy. A lot of people will say their AI is further along. We're in decision tree modeling still. And so right now, the environment has to have a stimulation input and it has to follow along with the patient. What we're working towards right now with the data pipeline we are building is predictive algorithm outcomes for patients suffering from PTSD and TBI. So trauma induces the neurovascular injury. That neurovascular injury is now introduced to NOVA, our engine. Our engine then recalibrates the performance of the user inside the environment, increasing the blood flow and leading to long-term recovery.
We work in our rehabilitation center with PTSD in a comprehensive way. So we involve different specialists like psychologists, psychiatrists, neuropsychologists, neurologists, and physiorehabilitologists. So how do we use these VR glasses? We apply them 20 minutes before the session with the psychologist or psychiatric. And after this, our clients have a session. They notice that it helps them to relieve the traumatic situations in like a safety surroundings, and it gradually helps them to reduce these stress factors.
I know we're pressed on time, so we wanted to make it very concise on why we're winning. We're using data instead of emotion to treat soldiers on the front lines, addressing the core root of what PTSD is on the body, looking at that physiological injury mechanism. It's proven treatment, and it's proprietary data that we're utilizing in conjunction with Ukraine. Thank you. I know we're pressed for time, so if anybody has questions or want to reach out to Dr. Katerina or myself, our contact is on the screen, as well as a little quote from our company, and thank you.
Thank you.
Друзі, дякуємо.
Thank you so much. Thank you so much, Ms. Katerina, Mr. Brandon.